Hi, I'm Jen Long. Welcome to 120 over 80 Marketing's Vital Conversations on Tech and Healthcare. We just heard from Tony Boselli of CareDox about the value of bringing primary care to K-12 school districts. Let's take a look.
So when you talk about the PCP, the primary care provider, in pediatrics, it's your child's main pediatrician where you're going to go and get that basic preventative service when they're sick, and the main family member or the parents don't know what that means. I mean, they just know it's the doctor they go to when they have the ear infection, the sore throat, and it's different depending on the population you're talking about. As you look at the Medicaid population, I think that's what we want. We want the PCB to be the medical home, to kind of be that quarterback to make sure we're driving care to where it needs to be. And so our whole goal is to create a platform to coordinate and enable care for every child, and to become, I don't think we want to compete with the medical home, but to be the hub where that we can make sure they're getting the proper care and to be that front door. And we feel like leveraging schools and partnering with schools to do that is a very effective way. Because if the goal is to create better outcomes at a lower cost and to make sure people are living healthy lives and getting the management and managing diseases like asthma, 11% of the population, pediatric population, has asthma, and urban population is much higher. It's one of the more preventable or treatable to make sure it's managed properly with some basic education. It's not just getting all the data to drive outcomes, which we feel like we have a great advantage because we're getting the daily activity from school nurses where they are, because that's where we are, but making sure the average child gets the care they need on a preventative and care management side. Why shouldn't every child at school have access to the basic preventative care and education around nutrition and all the different things that are simply easy to do if we connect it? And one of the things, the advantages we feel like we have over anybody is that we are leveraging the trust that a parent has in their school. So we are creating a relationship through the school with the family and their child. And I think the question will be asked is why should, for pediatrics at least, why should preventative, non-acute, and care management not be done right where the kids are? Where you don't need any more brick and mortars, you can use technology, and you can literally go and make sure kids get the care they need, which will then have benefits generationally because you're training them how to access care, how to take care of themselves. And that's really where you're going to see change, is as soon as you allow people to own their health care.
That was great. At 120 over 80 Marketing, we're excited to make these vital voices part of the healthcare innovation conversation.